and lifestyle. Lee Health clinical dietitian Noel Konken says these are the three major components to heart disease.
The American Heart Association has set the standard that Americans should be eating no more than 2,300 milligrams of sodium per day. That is a little bit less than a teaspoon of salt per day.
To help lower your salt intake, she recommends cooking more meals at home.
A lot of extra salt is going to be coming from dining out or eating at fast food restaurants. When you cook at home, you have all the control in the world. You get to pick the ingredients that you're putting in the dish. You also have control of the salt shaker.
It's also important to evaluate how much saturated fat and trans fat is in your diet.
The American Heart Association recommends that you should be limiting the amount of saturated fat and avoiding trans fats. Saturated fats and trans fats have a detrimental effect to our LDL cholesterol, so that's the cholesterol that we want to avoid.
When choosing your meals, look for options that contain low-fat dairy, lean cuts of meat or fish, and healthy fats like nuts, seeds, oils, and avocados.
The CDC says almost 50% of Americans have some form of heart disease, and it continues to be the #1 cause of death worldwide.
Making it important to evaluate your nutrition and increase your physical activity. All can lower your risk for heart disease. For Lee Health, I'm Lindsay Morton.